This is the how piece. You said, what's next? How do you make change? You know, you guys know a lot of what the problems are. This is my Coles Notes version of Public Policy 101. Traditionally, elected officials, we all know they're the key. They're the key to making things move forward, or they're the key to things standing in the way. Traditionally, they have been driven by the transaction. But they want to be in the headlines as collaborators. So when you're good at public policy, you exploit that. But understand, so this is one of the things that when I'm working with patient groups, this makes them uncomfortable. Because when you are really, really emotional and passionate about your story, it makes elected officials nervous. Because that's tomorrow's headline. And in the way change happens today, you can get a Band-Aid on something by creating a really emotional appeal. Because they'll give you a quick, simple fix to something that you want to have done. You talked about, I don't even know what that is, but the Tampax tax. That was probably, that's what I would call a simple fix. That headline they can live with. And because you did it, I don't mean you, but that was probably done quite publicly. The response was public, but it was also probably relatively low impact. You will never get systemic change with a big investment by doing public policy in the media. So what you need to do, though, is remember that if they're thinking transactionally, but they want to be celebrated for collaboration, you need to think about who their voters are. Women is a very strong voter base. And so when we went from uterine fibroids and endometriosis into a women's health coalition, when I talk to the elected official, I'm talking about female voters. I go in and I say, there are more than X number of women in your constituency. There are more than X number of women in Alberta. There are more than a certain number of women between the age of 20 and 35. And I talk about their voters. The next piece is they're always thinking legislation. So you might be talking to them about healthcare inadequacies, wait times that are too long. What they're thinking is, what legislation do I need to change because of this conversation I'm having with this voter? And then they're thinking cost. So these are their three drivers. To put them in the context of a more collaborative conversation, broadening the audience that is having the conversation with them will be the first step, because that's a collaborative model. It can't just be patient to government. It has to be patient plus industry plus community plus government, maybe some providers of service to that field. So as soon as you go from thinking transactionally to collaborative, so transactionally, I'm going to buy something from Pat. Collaboratively, I'm going to talk to you all, and we'll create the common interest, and then we'll ask for that. So as soon as you start thinking collaboratively, then you can start to define social impact. Again, social impact can still, in his mind, he can still be thinking, okay, so who are the voters when we're talking social impact? And then change. Change could be that industry is asked to behave in a different way, or a community organization that is providing support and services is asked to behave in a different way, because he's thinking legislation. What do you want me to change in the areas I control? You take the pressure off that politician as soon as you involve more people, more jurisdictions, more agencies in the change formula. And then he's thinking cost. You need to talk about partnerships so that you don't go into the conversation with a politician saying, you're going to have to shoulder all the costs, because he'll say, you know, if I support your program, and Dr. Leyland said this too, in his own budget, it's finite. So if he switches to doing more of these surgeries, it's going to mean he has to give up some on this side. So think, instead of cost, talk about partnerships. And when I'm doing, again, any kind of public policy and collaboration, and I work in a lot of different industries, not just health, I often say that think of government as your venture capitalist, think of industry as your sustainable funding partner, because that's a formula that government can get on board with. They don't want to support you for the next 100 years. They want to facilitate changing the way something is currently happening, and a lot of governments will say in 3 years, even a lot of industry will say, I'll give you some pilot funding, but if something doesn't change in 3 years, it's going to dry up.